The best of Money Matters. Right Business.
Welcome to The Right Business, where we dive deep into the stories of trailblazers who dare to disrupt the status quo, find the gap in the market to find the right business. Hello, I'm Hongbin Jeong. Now, providing at-home veterinary care is a game changer for pet owners. It offers convenience, comfort, and personalized medical attention. But when pets grow older, develop chronic illnesses, or require end-of-life care, the options available to their guardians become increasingly limited. Euthanasia, while a common option, isn't always the path every pet guardian wants to take. So this is where Fur Folks Home comes in, Singapore's first standalone pet hospice founded by Dr. Angeline Veterinarian and co-founder of VetMobile SG. So to share more about how Fur Folks Home is reshaping end-of-life care for pets, joining us today is Dr. Angeline Veterinarian and co-founder of VetMobile SG. Doctor, thank you so much for joining us today.
Thank you for inviting me.
All right, Dr. Angeline, we read that during your time providing at-home care with VetMobile, you noticed a significant gap in the care available for aging and terminally ill pets, especially during COVID-19 pandemic. So recognizing this gap, how did that inspire you to create Fur Folks Home?
All right. So when you go to people's home, you see how they take care of their animals. So maybe I give a few examples. So one of them is this old lady that has problem squatting, and she herself has some medical conditions. But she also had this really old dog that needed more care. Right. So it was really difficult for her because she was supposed to go for a surgery herself. And then, after that, it would be really hard for her to take care of this very, very old dog. At that point, I thought, if I have a space where I could temporarily take this dog in, take care of the dog while she recovers from her surgery, and then she can bring her dog home after that. That would be great. But unfortunately, we couldn't find a solution for her. Right. So eventually, we had to let the dog go because the dog is already unwell. It's not like the dog is perfectly well, but then I felt like the euthanasia could be delayed a little bit if we have other options as well.
Right.
Yeah. So, and also we have noticed as, people are going back to their normal working hours, many of these pet caregivers are not able to stay at home as much with their pets who are not as mobile. So then, when they get back, they see their pets covered in urine, covered in poop. It could be difficult for them and difficult for the pet as well because it affects their quality of life. And they get pressure sores, they get urine scalding and things like that. So then we thought, if in the day when they go for work, they could leave their pets with us and they could feel at ease, and then they can bring their pets home after that. That would be great. And so we started Fur Folks Home.
I completely understand. I have a dog back home in Korea, and he's now at that age as well. So my mom has to kind of take my dog out to do its business outside, and it can't walk anymore, it can't get up anymore. So I completely understand where these guardians have to go back to work, especially after COVID-19, and it's very hard to take care of these dogs. So I would love to know more about Fur Folks Home. It is Singapore's first standalone hospice for pets. Help us understand or share more about how or what Fur Folks Home does and the range of services you offer.
Okay, so we do have medical daycare, like what I spoke about just now. So you can choose to leave them there when you go to do your job or whatever you need to do, and then you come and pick them up after that. We also do medical hospitalization. So let's say you have pets that have special needs. For example, they need their bladder to be expressed, they need medication regularly. You can choose to leave them with us for a few days to a week or more, depending on how long you'll be away for. Yeah, we can also do bath and grooming for them as well while they're with us. So to make sure that, they're kept clean, they're not developing skin condition because of their bodily problems. And also we can do blood tests. We have a lab. Yeah, basic nursing things, can do those as well.
So is each staff or member of a Fur Folks Home in charge of one pet, or how does it work?
So on each shift, we have about 2 staff on duty. So everyone will be in charge of caring for all the animals. So it's not necessarily one staff to one pet, but then, sometimes we just have one or we have 2, and it ends up maybe that would be the case for them.
I see.
Yeah, because many of these pets require like more intensive care.
And I believe your approach is kind of sets you apart here because you've integrated both traditional Chinese veterinary medicine and Western medicine in your practice. How does this unique combination enhance the quality of care for pets?
So TCM, or traditional Chinese medicine, I feel like it teaches me to see things more holistically as a whole rather than like a part of the animal. So for example, when I look at an elderly animal, I don't just look at his legs because he cannot walk. But then we look at the general look of the animal, whether the animal is happy, whether the animal is still enjoying life, whether there are any other things we can do to sort of assist this animal's quality of life. So I think that's what TCM is about in general. It's like a lot of people have this misconception that TCM is like a miracle or like it's something you do only when you run out of other options. But actually, I feel like TCM is a way of life rather than like a miracle drug. So I do both TCM and conventional medicine. So in that sense, I can do things that might make the animal's life better, like for example acupuncture, or we can prescribe herbal medicine as well together with the conventional medicine, and then that could sort of make the animal feel possibly a bit better than what we could do with just conventional medicine.
I see. And it looks like Fur Folks Home focuses on short-term specialized care rather than long-term stays. What led you to prioritize this model?
Because like we were just thinking, if we do long-term stays, then we'll be more like a shelter than like a hospice facility. Because unlike people, in like a human hospice, usually those patients are going to stay there till they pass on, right? But I feel like for animals it's a bit different because they're more attached to their caregivers.
Yeah.
And, like the quality of life of an animal really drops whenever they're apart from their caregivers. So I don't want that to happen, and I don't want it to be like a dumping ground for unwanted animals.
Right.
So we decided to say that, it's just for short term. You are supposed to bring your animals back so that, they can still spend time with the family.
I see. Well, you've also developed a care model that combines medical treatments like blood collection and diagnostics with emotional and physical care. How do these elements work together to improve the well-being of pets in such a delicate phase of their lives?
So get a lot of sort of feedback from owners. They were saying their dogs are older and then going to the vet clinic, having to travel there and, having to wait in the waiting room. It could be stressful for them. So Fur Folks Home, it's an open concept place. So many of the animals that come in, they don't even know they're in the vet clinic. So then we'll assist them with whatever procedure they need without lifting them on an examination table. So it's less clinical and it's less stressful. For example, we have a retriever. The retriever will just be sitting on the floor like at home, and then we'll just take blood from the retriever. So then he doesn't even know we were doing anything to him. So I feel like it's kinder for them, especially if they have pains here and there.
And I believe our animals know that when they're en route to the vet and they will, start shaking or shivering, and they know that they're inside the vet, which they hate the most, like humans, right? Going to the doctors is just a scary part of our lives, even for our pets. Now, beyond traditional pet boarding, you also offer specialized services such as day and overnight hospitalization, medical care, and hygiene support. What inspired you to go beyond the usual model of, pet boarding and include these medical and palliative care services?
We actually spoke to other people who do like boarding services, daycare services. So usually they are unable to take in pets that require more care or like elderly pets because the younger ones, the more rowdy ones would create too much of a ruckus or injure the older animal. So then thinking about that, that was also one of our motivation for starting Fur Folks Home because we are actually limiting the patients we take in. So if the pet is healthy, young, we don't accept them at all. So we only accept older or the sick ones, and then we can help them with all this extra care that they need.
I see.
Yeah.
I see. Usually, how much do you charge for pets to, have a daycare or overnight stays? And do you charge extra for extra medical needs?
So far, I can't exactly remember the cost. It's up on our social media, but I think don't quote me. I think it's better if you check.
Yes, we'll check. Is there additional cost if the pet requires any medical care or medicine or treatment like that?
No, we have not been charging more for those. If there's a need for blood tests, we'll definitely charge for the blood tests. But for let's say wound cleaning, for a few of our patients had feeding tube, so we had to do feeding tube cleaning. We didn't charge more for those as well because we have to think about a lot of things, paying the staff and then also making sure the service is still affordable and making sure that people don't think that we are just out to rip them off. So I feel like because of all this, that's our pricing model at the moment. In the future, we might change, but at the moment, we try not to have too many little charges because that, I think, makes people feel a bit uneasy. They weren't told beforehand and then suddenly there are extra charges.
I see, I see. So when a pet owner do come to Fur Folks Home to request for a service, do you go through the things that the pet do need? Is there an interview or questionnaire process that you have to go through?
Yep. So before we can accept them, usually we'll ask for medical history from their vet so that we can understand their conditions better. And then I'll do a consultation with them to make sure that we're on the same page. Because what we don't want is, a pet with extremely poor quality of life, and yet we are just extending the pet's lifespan without considering things like pain relief, pain management, and things like that. So basically that's for us to understand each other and set out, the care plan for this animal involved. And then they can make an appointment with us, and then we'll just block out the dates for them, and then they can bring their pet's favorite, beds or whatever they need. And then, that's pretty easy.
I see. Well, what has been the feedback so far from people who have used Fur Folks Home?
So far, I think I wish to say that, but from what I can see, all the animals are quite happy.
Okay, that's good.
If
they could speak,
I think they would be 5-star or something. But I think the animals are happy. For the people, they're generally happy. There were a few who asked us whether, we can charge them a little lesser and things like that. But, to be honest, it's hard to keep this place afloat. We barely break even every month.
Right.
So our aim now is actually not to make money from this new service, but just to break even. And and we do give a discounted price to shelters and people who really need help. So that's what we usually tell people, and that's why we can't give them a discount.
I see. Well, as Fur Folks Home continues to grow, what's next? Are there any new services, features, or any initiatives you have lined up in the coming months to further improve the care experience for pets and their owners?
So now we have more volunteers joining us.
Okay.
We are so fortunate to have them. They came up to us and they say, can we help you? And all these people are really valuable to us. And because of them, we can think about doing more like what you mentioned. So the next thing we're thinking of doing is a community clinic. We were discussing this amongst our staff. Once we have a stable flow of patients and we have our staff are more familiar with things, maybe we can start doing a regular community clinic to help people who needs a bit of assistance with vet bills.
I see. Amazing. And for our listeners who might be very interested in, maybe having their pets to Fur Folks Home, is there a way to reach you? You mentioned a social media account. Where can we find you?
Okay, so you can go to our website. All the information will be there. So it'll be www.vetmobilesg.com. If you're active on Instagram, you can come to our Instagram. You can see pictures. I think it will be a more interactive experience. And if not, you WhatsApp us. I think that's better.
Okay, well, thank you so much, Dr. Angeline, for joining us today.
Thank you.
If you want to find out more, do visit their website. And that was Dr. Angeline, veterinarian and co-founder of VetMobile SG. This has been The Right Business with me, Hongbin Jeong.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.